Good. Thank you everybody for coming, and we are very happy today for the afternoon's talk. We are joined by Firas Hamdan. I hope I pronounced your name properly. I
Yes.
didn't ask you. Good, good. He will be talking us about how sometimes our immune system can be triggered by a virus in a very interesting way. And based on his title, Catching a Virus, Another Flu, or a Treatment for Cancer, I'm very excited to hear what you have to tell us. But before we jump into that, we would like to uh, tell our audience that at the Science Basement, we are a science communication organization based in Helsinki. It started from some PhD students at the Biomedicum at the University of Helsinki, and it has expanded all over the campus. And we are very happy if people want to join a lot of activities, such as the afternoons for which you are here today. We are also having a podcast where we interview people about their research. So if you want to be interviewed or if you want to give a talk, these two events are very well suited for you. And then we also have the opportunity for people who want to do blogging, but maybe they don't have the time for themselves to maintain a blog on a regular basis, then they can write interesting articles, and we publish them on our website. And we have also a Lego Lab and art and science projects, which are at the moment a bit on halt due to the corona situation, but we will be very happy when things get a little bit back to normal and we will revive them. We have the website, thesciencebasement.org. And of course, we also have a Facebook page, an Instagram, and a Twitter. And you can follow us and follow our activities and communicate with us on our platforms. And then, of course, as I said, if you're interested in being a speaker for our afternoons, like Firas is today, then just contact us at afternoons@thesciencebasement.org. So I will stop sharing and give the floor to Firas so you can start your presentation.
Perfect. Well, first of all, thanks everyone for actually joining in. And I would like to first thank the Science Basement for actually having me here today. Because of course, as a scientist, I really feel it's very important for us as scientists to talk about our work with the public. Because A, most of our money, our grants come from the public's taxes, but also B, you never know how our research could actually change the public's life. And in today's talk, I will be talking about how could we actually use viruses to treat cancer, which comes to, the title of my presentation, Catching a Virus, Another Flu, or a Treatment for Cancer. But before I get into the details of this talk, I want to give you a small little introduction to, who is this guy behind your screen giving you this presentation. Oh, there you go. So I was born in Spain, but both my parents are originally Lebanese. So you can kind of say I'm a kind of a hybrid of a half Lebanese, half Spanish. And I'm a basically trained biomedical scientist since I did my bachelor's in that in the UK. But I then went on to specialize in cancer biology and infection immunity, which I did that in the UK, Netherlands, and Australia. And currently, right now, I'm in Finland, creating new therapies for cancer using viruses, hence, the talk of today. But of course, as you can see, my life has not only just been about academics. I'm an avid player of handball, basketball, and as well athletics. I like to do a lot of long run and long jump as well. So kind of introducing the setting of my talk, I want to start off by, introducing the 20th century, where we like to call that, the modern medicine times, because that's the time in where we actually started to understand diseases and come up with new therapies. And we kind of have to thank these brilliant chaps right here. So, for example, here, Rudolf Virchow, which was the inventor, who discovered, what cells are and how they divided, and kind of gave birth to this, the modern pathology, which is the study of diseases. So Robert Koch here actually came up with, the fundamentals of bacteria. And because of him, we started to understand what are these small little microorganisms that can actually cause us, a lot of diseases and death. And because of his work, we started to actually develop, the antimicrobials, specifically antibiotics that has saved thousands of lives. And of course, now Louis Pasteur was one of the first pioneers in discovering the principles of vaccines, something that we really are in dire need right now, specifically with the corona pandemic. But of course, during the 20th century, one thing we started to actually have a rise in is cancer. And if you want to define cancer from a very, simplistic manner, you can imagine this being a normal cell, a very happy cell. Suddenly, this cell turns evil, shown here in red. And this evil cell, it's evil because it starts to grow uncontrollably to a point that it kind of forms a big mass we love to call tumor. And this tumor ends up killing you by the end of the day. The thing about it, there's a kind of a hypothesis that around a day, we get 1,000 or more cancer cells on a daily basis. But our immune system, shown here in blue, are able to kind of sniff them out and kill them. But sometimes our cancer is able to kind of camouflage itself or kind of hide, because here comes, another immune cell shown in orange, will come, sniff it around and sleep, because the cancer cell has kind of camouflaged itself in a way that our immune system doesn't see anything wrong. So then the tumor starts to grow. So of course, during the time of the 20th century, we only had two types of therapies. The first one being chemotherapy. And the chemotherapy back in the day was quite, let's say, not as advanced as current days, because we were using these chemicals that were used in World War II, specifically castor oil and arsenic, which are quite very toxic compared to the chemotherapy right now, which is way much better. The surgery, the second type of therapy was also surgery. And the surgery back in the day was not as modern as currently, because during those times, the majority of the surgeries that were performed were on breast cancer. So you would get a patient, the surgeon would go in, open up the breast, remove all the tumor, but also all the muscles, tendons, ligaments that he could find, because the surgeon would be very afraid to leave any microscopic or little small tumor cells around, because those can then form another tumor. So their aim was to remove as much as possible. So that was kind of good, because you were making sure there was no tumor. But at the end of the surgery, the patient would be actually debilitated to a point that they couldn't move their arm, because of course you've removed so much of the muscles and ligaments that it's kind of paralyzed, it's kind of gone. So there was a really crucial need or dire need for novel treatments during the time. And in 1896, a possible treatment came out. And it all began with this medical paper that was published in 1896 by George Dock. And it was about a woman, 42 years old, presenting with leukemia, which is kind of a cancer of the blood, cancer originating from the blood system. She was, in a very, let's say, hard, kind of given a death sentence. She was kind of sent home. There was no hope for her to live anymore. And then she contracted, the flu. She got sick. And then suddenly this doctor saw that she actually got better by contracting just the flu. And during that time in 1896, we still didn't know what a virus was. It was only 1 year later, in 1897, Martinus Bergenic actually came out and started to say, discovered or named these organisms as viruses. What causes the flu or these diseases? He called them viruses, which are these little small microorganisms that contain, two different types, like either DNA or RNA. And if you want to go into the details of what DNA or RNA, they're just genetic information that is kind of a recipe to create more new viruses. So if you want to look at, like the life cycle of a virus, the virus comes into our body, it infects, and attaches to your cell. It goes inside your cell and releases your DNA or RNA, which I was saying before is kind of a recipe for it to multiply inside your cell. So suddenly from one virus particle, you will have two, and then going from one to hundreds of thousands of particles, which then, of course, leave your cell and start infecting other cells. And if you want to see the types of viruses, well, we know that there's million types of viruses that actually are able to infect us. And I would say the great majority of them do not harm us. We actually coexist in harmony with them. But of course, some of them can cause diseases, such as HIV can cause the very famous a disease called AIDS, the acquired immunodeficiency syndrome, which kind of wipes out your immune system. Hepatitis B, which infects your liver and creates such a big inflammation there. But also Ebola virus, which has been on the news the past years because of its famous outbreaks, because of course it causes such a big inflammation in your blood. So of course now, doctors knew during that time, it's like, okay, this woman that actually contracted the flu got the influenza. So they thought, could the influenza virus have caused, this remission of her cancer? And a very similar case came up again in 1951 with a 4-year-old boy. So this boy was presenting with leukemia, and then he got chickenpox, which is a very common virus we get as children, and gives you this, varicella-like little spots around. And this virus infection kind of brought his tumor back to it kind of made the tumor shrink. So before the infection, if you took 1 drop or 1 microliter of blood from this patient, which as you can see here, this small little tiny bubble compared to the penny, so you see how tiny and small it is, there was 200 cells, white blood cells there. So most of those white blood cells were basically your tumor cells. And after the infection, from 200, it went back to normal to 4, which is actually the normal count you get. So imagine just from a simple infection, his white blood count, the tumor number of cells went from 200 to 4. So basically almost 0. So of course, was this a coincidence? And as scientists, we don't just like to hypothesize about stuff, but we like to also test them. So of course, we wanted to do certain clinical trials to test this. But this was the 20th century, and we were dealing with a disease that we were very desperate to cure, because a lot of people were actually dying from it. So the clinical trials that were done during those times were quite extreme, to a point that they would not pass nowadays, because they were actually taking patients, cancer patients, making them sit with patients who had actually, flus or certain viral infections to kind of allow the virus to transmit. Or they would actually give their cancer patients rags or tissues filled with viruses for them to sniff. This is something that, would never happen nowadays. But again, just to say that during those times, there was a really dire need for them. So there was 3 very famous clinical trials that occurred, and that was your hepatitis B virus, the Egypt 101 virus, and the mumps virus. And as you can see here is the number of patients enrolled. So with hepatitis B virus, out of the 22, 4 actually had a reduction in tumor size. With the Egypt 101 virus, 4 also out of 34 had a tumor regression. And the mumps virus, out of 90, 37 had a complete regression. So did it work? Kind of, yes. It was treating some people, but not everyone, and it was definitely not a cure. But the most striking thing, and of course not striking, but I would say alarming, was the side effects. Because with hepatitis B, people were getting fever, malaise, and even death. With the Egypt 101 virus, people were also getting fever, malaise, and mild encephalitis. Malaise is just a medical term we like to use in medicine that describes this very, let's say, tired feeling you get after an infection. When you get the flu, you feel very tired, your muscles ache. That's what malaise is. And mild encephalitis is a inflammation of your brain, so very life-threatening. And the mumps virus was causing very bad effects as well, such as bleeding and fever. So these viruses were kind of treating people, but their side effects were really toxic, really quite bad. So this kind of era of using viruses kind of died out. Specifically, that new treatments started to come out, like targeted therapies. And these are basically chemicals that specifically target your your tumor cells. So with less side effects and more efficacy. Or this new era of therapies called cancer immunotherapies, which kind of boosts your immune system to combat your immune cell. But still, we were still able to, we were still listening, or still got cases in where people with severe cases of cancer were being completely treated or even cured from viral infections. And this was actually a couple of years ago with a 60-year-old woman with lymphoma, which is again a cancer originating from your white blood cells. So this patient acquired multiple infections: pneumonia, Clostridium difficile, Epstein viruses. So these are different microorganisms she got, specifically this, in the center, which was the Epstein virus. After these infections, her tumor actually shrank to almost zero. So if you see here in these kind of pictures, in the left panel right here, you have a CT scan of the face. So you have here, let's say, the nose. This is the left cheek, the right cheek. And what you clearly see is that there's a clear, like kind of white swollen left cheek around here. Your right panel is a PET scan. So it's a different type of imaging, and where you inject a dye. And that dye only kind of lights up in the presence of cancer. So this swelling here corresponds to the tumor. And this was before she got the infections, and this was after. You see no more swelling, and the tumor, basically the dye is just a very tiny bits around here, but I would say it's almost kind of gone. And this was 6 months later, basically nothing. So this kind of treatment, or like a viruses, kind of actually treated her after 6 months. And the newest case even came out with the coronavirus. And one thing I really want to say is that there has been a lot of studies about people catching the coronavirus while having cancer. And I would say almost like 99%, 99.9% die. Most of the cancer patients that get the coronavirus infection die. But with this patient, he actually got cured. And this is a rarity. So this was a 60-year-old man with Hodgkin's lymphoma. And this is, again, a type of cancer of your white blood cells. This man was discharged home with basically zero hope. They tried all the newest treatments possible, and nothing worked. Until he got infected with the coronavirus, and he actually kind of got treated, even cured maybe. We still don't know if he's 100% cured, but all we know that his tumor shrank. So this is again a PET scan of his whole body. So he uses his liver, his stomach, and this let's see, up here is his head. So the PET scan again was a dye that when you inject and in the presence of a tumor, it kind of, let's say, lightens up. So here these black blobs are all the tumor cells or cancer cells around. So what you see is that he has quite a lot of cancer spread around his body. And this was before he got the corona, and this is after. Basically gone, almost. And up till now, he's still alive. So of course, one thing we wanted to know is, why is this happening? Why is a virus that we all know, once it gets into your body, all it does is basically give you a disease? But in these cases, they're actually kind of treating cancer patients. So 3 explanations came out. That was direct killing of tumor cells from the virus. Second, increasing your immune system to fight cancer. And third, molecular mimicry. And of course, I will go into a bit more explanation into each explanation, specifically number 3. So direct killing of tumor cells from the virus. As I said before, a virus, its job is to go infect cells, but in this case, it infects your tumor cell and it starts to replicate, and going from one particle, it will go to hundreds of thousands. And this amount of viruses produced will actually cause the whole virus to the whole tumor to lyse. And that's one way of how a virus is able to treat the tumor, basically a cancer patient. Second is increasing your immune system to fight cancer. And one thing I was saying at the beginning of this presentation is our body is able to, let's say, detect cancer and kill it in a very good way. because of course, on a daily basis, you get tumor cells and your immune system is able to shut it down. But sometimes your tumor is able to kind of camouflage itself. So sometimes getting a virus can actually wake up your immune system or kind of make it even more powerful. And this, these immune cells shown here in blue will be more stronger and able to recognize maybe your cancer this time and kill it. The third one is molecular mimicry. And this is my favorite one by far. And I think you guys will find this very interesting. So molecular mimicry, as its name kind of says, it's similarities. And I will start to explain this, but first I want to say what happens when we get infected by a virus. So let's imagine this is a virus that you get infected with. Your immune system comes in, specifically this orange policeman, and this guy is a dendritic cell. He comes, he picks up the virus, takes out the scissors, and cuts it into small little pieces, in which we call peptides. And these peptides kind of form or kind of can be used as an ID, sort of a documentation of the virus, because then this dendritic cell gives these peptides to other immune cells, specifically your T cells shown here in blue, and will tell it, hey, go and kill everything that has this peptide. So again, serving as some sort of identification. So your immune system now knows what to do. So your immune cells start come up and go and kill your virus. So this is how, when you get the influenza virus or the flu, you have this time of getting sick, but then after 1 or 2 weeks, you're kind of, let's say, cured, because your immune system now has developed all these reactions and your T cells are there now killing your virus. And as I said before, in cancer, sometimes cancer, your immune system or your dendritic cell is not able to sniff it out or kind of recognize it as something bad. So it sleeps and the tumor starts to expand. But sometimes the virus you are infected with might look very similar to your tumor. Of course, right now they don't look very similar, but if you cut them into pieces, there might be some peptides that look very similar to each other. For example, this red one here from the virus and here from the tumor, they're not the same, but very similar. And this can cause some sort of confusion with your own immune system. So let's imagine you get infected by a virus that looks, a bit similar to your tumor. Your dendritic cell comes up again, gets a scissors, and cuts it into peptides. So the peptides that, the green peptides that are pertinent to your virus will be given again to your T cells, and they will go kill your virus normally. But these red peptide that looks similar to your tumor will be given again to your T cells as well. And your T cells will be kind of confused when they see the tumor because, this red one looks very similar to the tumor. So it kind of gets confused and kind of allows it and kind of, says, okay, let's go and kill it. So it's quite interesting how this confusion of just a virus leads to this killing. But as I said before, this only happens, with the rarities. As I showed you in the clinical trials, out of 30 people, 4 of them actually got a tumor reduction. Like the size actually got reduced. And of course, this implies that that the virus you get infected with actually has to resemble your cancer. So that doesn't happen most of the time. So in our lab, we're like, how can we make a virus look similar to cancer? So what we did is we got a tumor, we cut it into small pieces called peptides again, and we stuck the peptides all on top of the virus. So we kind of got the virus and dressed it, made it look like the tumor. So what happens is that when you inject this to a tumor patient, the dendritic cell comes in, cuts it into pieces, and gives it to your T cells. Because of course, the peptides that are now released are all tumor peptides. So the peptides that will be given to your T cells are these wanted signals against your tumor. So now here we're actually driving this confusion from this viral infection. And of course, this will go and shrink your tumor. And we call this Peptic rad, dressing a virus in tumor's clothing. So of course, we wanted to test this So what we did is we got a mouse. And in this mouse, we injected a tumor called B16 ova. And that's just the name of the tumor. And we know in this tumor, they have a lot of these little peptides called synfecal. So what we did is we got a virus and we added synfecal all over it. So hence the Peptic rat, or kind of this, dressing a virus in tumor's clothing. So in this graph, we have the x-axis, which is the time in days, starting from 0, 2, 4, 6, and 8 days. And the y-axis is the tumor growth, starting from 100%. And as you can see, with the mark, so these are mice that have not been treated, nothing's done to them. You get to see that the tumor starts to grow, almost reaching 400% by day 16. When you add virus alone, so this is just normal virus, nothing's done to it, just injected, nothing happens again. But when you add Peptic rat, so this virus that is covered in synfecal, look at the tumor. You see a very clear, not just a tumor stoppage, but a clear tumor reduction to a point that it's almost gone in these mice. So we wanted to see, why is this actually happening? Why is this working? So we wanted to count how many of these policemen or these T cells were against synfecal, so the tumor. So with the Markin virus, you have a very little amount of them actually occurring. But with the Peptic rat synfecal, there's a bigger amount compared to Markin virus. So we were able to actually confuse your immune cells to go and attack your cancer cells. And of course, this is just a one mouse experiment, but we've done a lot of them in our lab. And to a point, this has now turned into a company called Valo, which are trying to, by the end of this year, to test this in humans in a phase 1 clinical trial. So the take-home message of today is kind of course, right now we're living in a pandemic, and where, of course, this coronavirus has really extremely changed our lives, sadly, towards the worse. But of course, what I wanted to say is that we can actually use viruses as a tool for treating cancer, that they're not only seen as a negative thing, but we can actually turn them towards something positive. Of course, I would like to thank everyone for paying attention. And if anyone has any kind of questions, please, add me on Twitter, send me your questions either on Twitter or by email. And if anyone is interested in what we do in our lab, of course, if you got interested in some Peptic rat, we have many other different types of treatments for cancer that we develop here in the IVT lab. So you can follow on Facebook if you want to keep updated with that. And of course, I want to thank all the people in my lab, because of course, all of us here were able to do this amazing job. So I will basically open now to questions.